name is Ter Louw. I'm one of the plastic surgeons at Muskegon Surgical Associates. Today we're here to talk about intersection syndrome. So intersection syndrome is a syndrome that happens in the wrist where two types of extensor tendons, their compartments, intersect. So this typically happens from a repetitive motion injury on the top side of the wrist or on the thumb side of the wrist. Typically happens about 5 to 6 centimeters above the wrist itself, where your first extensor compartment and your second extensor compartment intersect. The first extensor compartment allows you to lift your thumb out of the palm of your hand. The second allows you to extend your wrist. Where those tendons intersect above the wrist, you can get compression, and that causes pain. So when we see you in the office, you'll often have quite a bit of pain with pressure right over that area. Oftentimes you'll also have a little bit of numbness on the top of your index finger or thumb. Typically the course of treatment for this, it varies on the person and the type of work that you do. We typically try and rest and do compression and elevation for these repetitive motion injuries. If that fails and splinting fails, then we consider progressing to either a steroid injection, which helps with the inflammation in the area. That typically will last anywhere for 3 to 6 months. If that does not give you relief, we often consider surgery. This is a relatively unusual thing to encounter, but if you are interested or concerned that you have this condition, you should see us in the office. If you do require surgery, this is something that we do as an outpatient basis, something where you go home the same day. We place you in a soft splint for approximately 1 week afterwards. After approximately 1 week, we let people get back to starting their jobs and their hobbies with light duty. Typically at 4 weeks, you're able to go back to your job, depending on your case, at full duty. We often have people see the hand therapist after surgery as well, just to continue range of motion exercises and to help with your swelling. If you're interested or concerned about this procedure, every case is different. We'd be happy to see you in the office.